Leading health organisations, including the Faculty of Intensive Care Medicine, have repeated their warning that a lack of protective equipment, or PPE, is putting lives at risk, and they've called for a clear strategy to ensure a sustained supply. An RAF aircraft has flown to Turkey to collect a shipment of 400,000 clinical gowns. That delivery was expected yesterday. It's still not clear when it'll happen. Public Health England has admitted that the lack of PPE is a concern. Our health editor Hugh Pym has more details.
We've recently got these gowns made locally.
One care home's response to equipment shortages: get it made by local contacts.
These are the supplies that we have up in head office. As you can see, they're very limited. We have 10 litres of alcohol hand rub.
While supplies are still coming in, they're hard to get, and staff who look after residents with COVID symptoms fear they may run out.
We are putting not just our residents at risk, but also our staff, and that makes us feel awful, and it keeps us up at night, and we're trying our best.
Josie Ecoli was a nurse for 30 years. In recent weeks, she worked on COVID-19 wards and died with the virus on Easter Monday. She'd told her family she thought her protective equipment was not the best.
I feel like they should protect those in the front lines, because they're kind of sending them over there naked. I feel like without the proper protection, then more things like this and more families will lose a loved one.
The trust where she worked said they had implemented national guidance on protective equipment.
First of all, we're putting our gowns on.
For hospitals, specialist gowns and masks used in intensive care are in short supply. Some, though not this one, say they're down to only a day or so of stocks. Usually staff put on new items every few hours, but the guidance has been changed so they're allowed to wash and reuse the gowns. Frontline staff, though, are concerned about the situation.
We want to treat patients, and we never expected that we'd be putting our own health at risk by doing that. And not knowing whether you're going to be able to protect yourself is a worry that we shouldn't have to have.
One trust in Lincolnshire, made up of 3 major hospitals, has revealed how much protective equipment known as PPE they use in a single day. 39,500 surgical masks, nearly 11,500 gloves, around 1,500 gowns and about 4,200 specialist FFP3 masks. Including other items, the total is 72,000 for just one day. I raised the concerns about shortages in some areas at the Downing Street media briefing.
Are you ashamed as a government that there are some NHS staff going into work who say they're worried about their safety because they fear their hospitals might run out of PPE?
Absolutely. Everybody working incredibly hard on the front line deserves to have the equipment they need to be able to do their job safely, and we're working round the clock to make sure that we can deliver on that. Obviously, a billion pieces of PPE have been delivered, I think 12 million yesterday, and as you heard from me, we're improving our sourcing internationally and domestically to make sure we can get the PPE we need, but in what is a very challenging international context.
The Chancellor said there were delays with the planned Turkish consignment of PPE, but a shipment of gowns from Myanmar had arrived. With the new temporary NHS hospital in Glasgow ready to take patients, the Scottish Government said it was working at pace to improve the supply of PPE. And the opening ceremony was held at Cardiff's new facility at the Principality Stadium, with room for up to 2,000 COVID-19 patients. In a rare public statement, the Duke of Edinburgh said he wanted to thank all key workers and recognise the vital and urgent medical and scientific work taking place. Tributes have been paid to Dr Manjeet Singh Riat, an emergency medicine consultant at Royal Derby Hospital, who died after contracting the virus. There was more uplifting news at East Sussex Trust, as staff gave one of their own a round of applause today, a nurse who was leaving critical care. Huw Pym, BBC News.
Well, the government's declared deadline to be testing 100,000 people a day for coronavirus is less than 2 weeks away, and some experts say it's almost impossible to see that target being met now. And it's confirmed that yesterday just 19,316 tests were carried out across the UK. Now, in Cardiff, the Welsh Government has now abandoned its target on testing after failing to come close to the 5,000 a day figure set for mid-April. The First Minister of Wales, Mark Drakeford, says there were problems with sourcing chemicals from abroad, but there are also hundreds of unused testing spaces every day. The Welsh Government has called on military planners to review its testing system, but a new target will not apparently be set. So let's talk now to our health editor, Hugh Pym, who joins us once again. When they say today in Downing Street, Hugh, that the numbers of new cases are flat and stable, are they in effect saying that we've passed the peak?
I think, Hugh, they are saying we are at the peak, and the likely direction now for all the indicators is downwards. That new cases, new infections has been flat for a little while now. Now, the daily reported death toll, tragic though it is the lowest in 2 weeks, below 500. Now, let's remember that is largely hospital deaths, and of course it follows a weekend when there may have been fewer registrations, so we need to watch the next few days. And then there are the data on patient numbers in hospitals with COVID-19, and that chart was shown at the media briefing today, so let's take a look at that. And that's very important. You see London there, that line, that's been falling for 7 days now. And of course, London led the rest of the UK in terms of the number of cases. The northwest, having gone up a bit, has now flattened. Scotland, Wales is down a bit, Scotland flat. The east of England is the only one, we've picked a few here from around the UK, the only one that's pointing upwards. So I think all this is seen as very positive. They need a bit more time to assess the data, but they certainly don't want to give the impression to the public that the lockdown's about to be lifted. They're worried largely about the wrong signals being put out, and also worried about the possibility of a second spike sometime later in the year.
OK, Hugh, once again, thanks very much. Hugh Pym, our health editor.